Hi, my name is Kim Dwyer, and I'm the Director of Benefits for Advocate Healthcare. Advocate Healthcare owns 9 hospitals in the Chicago market, is the second largest employer in the state of Illinois. What Advocate has adopted with our Healthy You initiative is we have incorporated wellness programs within our health plan design. The purpose of that is to make sure that the wellness initiatives tie to helping manage health trend for the organization. So from that perspective, we like to treat everything from a holistic basis. To that end, our health benefit design also incorporates saving money for medical expenses during retirement, so it looks more broadly at the financial picture and what it represents to our associates. We feel that way we get the biggest bang for the buck in the money we spend on all of our benefit dollars tied to associates. Over the last 3 to 5 years, the Advocate has been looking at double-digit trend in medical cost, and so obviously any programs that can intervene and somehow suspend or manage that trend over time are really critical to our financial success. Well, when we look statistically at the information we've been able to gather over the last 3 years, it's obvious there are some simple interventions that can really reduce healthcare cost. If I look at our organization, an example, weight management really has a huge impact on what is happening with several different forms of diseases and lack of activity, as well as stress management and depression. So even if I focus on a single initiative, the expectation is that many of the people who take medication today would not even need to be medicated. And it will help us get our arms around those folks who are supposed to be medicated and are not complying. Well, I think it's important to look at your population and to risk stratify them. You've got low-risk people, and you need to make sure you keep them at low risk. You've got moderate-risk people who have potential to fall into high-risk category, and then, of course, you have high risk. An online application or tool combined with a health risk assessment really allows us to address all 3 of those different categories and then redirect them to the appropriate place based on the type of intervention that would be most successful for them. I think that more health plan designs are going to start to create exposure so that people understand what healthcare costs by engaging them in the cost of healthcare. And I think there will be rewards to offset that, but if those rewards can encourage people to participate in the right behaviors, then it becomes a win-win situation. It's been great. I love the opportunity to network with my peers. Just today, in sitting on the panel, I got 3 new ideas from other panel members about some incentives and rewards that I might consider offering for next year. So I just love to listen to best in class and pick people's brains to see what others are doing. Well, I think the greatest challenge right now is everybody is struggling to define wellness, and we're looking for some anchors where we can drive to a level of standardization. I think that will then help the people who sell the products and services to create more of a focus, and not unlike the insurance company where it is somewhat standardized in the way they offer benefits. I think wellness models and wellness programs should offer things that are more standardized as well. Finally, I do want to mention, because I am proud of the fact that Advocate is ranked as one of the 5 best places to work in Illinois. One of the things that we hold near and dear to our heart are associate satisfaction scores. And a lot of what you do when you implement benefit changes affects the morale. So it's very important to monitor and keep a good pulse on that. I was somewhat surprised last year when we made a fairly significant change, but we maintained our associate satisfaction score. So the lesson learned in that for me was a very, very strong communications campaign that doesn't just die with a benefits enrollment, but continues all year long so that people truly value what they have.